The Pregnancycare Show is proudly brought to you by
Cerelac. It's all good, Mom.
Having a new baby is often a pleasing and beautiful moment for both expecting mothers and their families. Yet, the moments following the birth of a baby are ones of great adjustment, changing body chemistry, lack of quality sleep, and numerous other stresses that may lead to women experiencing postpartum depression in the weeks or the year following the childbirth. A theory proves that 1 in 7 women will suffer postpartum depression. Postpartum depression is a mood disorder that may interfere with a mother's ability to care for herself or her baby after childbirth. Postpartum period is the most vulnerable time for a woman to develop a psychiatric condition. After birth, it is expected that this moment should be a joyous moment for the couples or the mother. But for some few people, this moment triggers a lot of emotions, from excitement to anxiety, from fear, and even to depression. But on today's episode, we will be looking at postpartum depression. What causes postpartum depression? What are the complications of postpartum depression? Is it the fault of the mother, or who is to blame? Welcome to the Pregnancycare Show. On today's episode, we'll be looking at everything postpartum depression. My name is Dede. Welcome to the show. And the show is brought to you by Cerelac. So on today's episode, I have with me a doctor here. He's going to take us through everything postpartum depression. Make sure you don't miss this episode. Hello, doctor.
Hi, Dede.
You're welcome to the Pregnancycare Show.
Thank you. I'm glad to be here.
Okay, so for the sake of our viewers, we want to know your name, where you work, and what you exactly do.
So my name is Dr. Isaac Sekom. I'm an ONG resident at the Greater Accra Regional Hospital. I also manage an office clinic called the Sekom Medical Center, which is located at Musuku, near Kwabenya.
So you heard it, or we are here with Dr. Sekom for today's episode. He's an Obs and Gynae specialist, or a resident. So he's an Obs and Gynae resident. We'll go for a short commercial break. When we come back, the show still continues. Welcome back. If you just joined us, it's still the Pregnancycare Show brought to you by Cerelac. So Dr. Sekom, when we talk about depression, just in general, what do we mean by depression?
So the day we all go through some mood swings once in a while. Maybe you get some broken heart, and then it's like you don't want to talk to anybody, you quell yourself down, okay. You are in your room, you don't even want to eat. That's a normal reaction to everyday problems.
Okay.
When you go through problems. But when it comes to depression, it's a little bit deeper than that.
That's okay.
So this is somebody who does not want to talk to anybody. He's lost interest whatsoever in his surroundings. He does not even want to eat.
Wow.
He cannot sleep. He can be on bed, he'll be tossing up and down, not able to sleep.
Oh, okay.
Some too, they sleep. They will sleep, you wake them up, they still want to sleep. So depression is really, it's a mood problem. Your mood, the way you feel, it's a mood challenge. So in this case, the person has lost interest in their surrounding, something you used to enjoy. Let's say you're a guy, and you like football.
Okay.
And it's like, now your friends are telling you about football, you're not even excited about it. That is a form of depression. But it must linger on for
Wow.
like 2 weeks or more. If this then lingers on for like 2 weeks or more, then we say that it's depression.
Depression. Okay. So for the purpose of today's episode, we are looking at depression on the part of a postpartum woman. So we are looking at postpartum depression. So what then is postpartum depression?
So it's depression that happens in the postpartum period. So the postpartum period is the period after a woman has given birth.
Okay.
So for us, postpartum period is like from giving birth to about 6 weeks. So 6 weeks from that's when we expect that the woman's body will go back to as the woman was before she got pregnant. So if a woman has depression, has like the things I've spoken about, the person not losing touch of his surrounding, not happy with his or her surrounding, like it's of course the woman. So the woman is not happy with her surrounding. She does not even feel like eating. She's sad most of the time during the day. If this one persists more than 2 weeks, then we say the person has postpartum depression.
Okay, so I think you've given us some of the signs and symptoms, but can you look into the camera and give us maybe if there's any clear signs and symptoms, so that maybe somebody who does not know, and maybe I'm a relative to such a person and I see that the person is exhibiting these things, I would be a bit worried that probably she's having this. So maybe you can give us.
Yeah, so if you have a relative who has just given birth and you realize that this woman does not even, at the point you realize she's lost interest in the baby, does not even want to carry the baby, she neglects the baby, and this woman, you see that this woman is sleeping too much, does not even want to eat, or this woman has problems with sleeping. This woman has lost, when you look at the woman looks so sad. It could be a symptom or sign of depression. This woman really needs help.
So in this case, who is at risk of postpartum depression?
Risk is something that can predispose somebody to getting the condition. Now, any woman who has had a previous history, in the person's previous pregnancy, the person had something like that.
Okay.
You need to watch the person, because it can happen again. If the person has a relative, a mother, a sister who has had this condition, watch this person can have a problem.
Okay.
And a woman who has had very difficult pregnancies, a woman who has been struggling to get pregnant, and as she gets pregnant, and then all of a sudden she starts having complications in the pregnancy, it can be so serious. This woman can easily go off.
Okay.
And also a woman who has had difficult deliveries, and the person has gone through a lot of bloodshed, traumatic moments during this pregnancy. This person, you need to watch. This person can easily develop postpartum depression.
How common is postpartum depression?
It's quite common.
Wow.
So let's get the spectrum here.
Okay.
Like a gradation of the problem. We have what we call the postpartum blues. Blue is that, Charlie, you're feeling some teary, once in a while you're feeling some quiet, down, like sometimes the woman feel like even crying.
For no reason. For no reason,
you feel like crying, but it does not linger on for some time. Just quickly come out of it. A lot of women have that. It's as high as almost 70% of women who deliver who have some blues. All of a sudden you realize that, hey, I'm a mother. Hey, is it true? And it's true, you're a mother. And this baby, as long as you have brought this baby outside this, like from your womb, you have the responsibility of taking care of that baby.
Okay.
You have to start carrying the baby, breastfeeding. It's not a joke. So this woman will have blues. A lot of women have
the blues.
About 20% of those who have the blues will now become depressed.
Okay.
So those people, it lingers on like 2 weeks. This woman is like depressed. Most of the time you're sad. More than 2 weeks, you have gone to depression. And there's one that is even wilder. We call it postpartum psychosis.
What is that?
It's more severe form
of the depression.
Yes, and that's what we normally will see in the clinic. Most people have depression, they might not come to the clinic.
Oh, okay. So it's not necessarily that somebody suffering from postpartum depression should seek medical advice?
The
or
person needs to suffer. Even if it's blues, you need to seek help.
Okay.
Because if you seek blue, if you have, there's something we call patient-centered care now.
Okay.
In the especially in ops and gynae. Patient-centered care is knowing your clients. That's what I try to do at my clinic. Knowing your clients, knowing the person's demeanor. So sometimes the client comes to the hospital clinic, I ask you, are you okay? Is everything okay? So most of the time I like that my clients should come with their husbands.
Okay.
I like to have antenatal with
couples.
Yes, couple.
Okay.
It's nicer. In that case, you see there's some subtle things that you'll be picking up during the pregnancy period. That might signal this woman is at risk of getting postpartum depression. So knowing this, then you plan ahead for her.
Okay. So would you say there is this lifestyle on the side of the woman that can still predispose her? And from that as well, what are the causes or the main causes of this postpartum depression?
So cause is difficult to tell.
Okay.
What causes it could be quite difficult. So that's why we mentioned risk factors. Risk factors is that it makes you more liable to more likely to have the postpartum. The cause itself is not known. But you see, science, we always keep doing some things. One of the things that they've tried to do is that they're trying to measure some hormonal issues in the woman.
Oh, okay.
So they're saying that, during the pregnancy period, your progesterone, the hormone, the estrogen, progesterone, they are quite high during the pregnancy period.
Okay.
So some people are saying that it is the drastic fall. You see, that might trigger a woman to having depression. But these are all postulations. There are things that people are thinking that could be the causes of these things.
Okay.
But the good doctor knows his or her clients.
Okay.
And prepares ahead for her.
Okay. So, from the lot you said, I still want to know more. Could a pregnant woman just show when she comes to clinic? Could you tell that the way this woman is behaving, she could fall into depression after birth?
One of the things that most Ghanaians, we don't do is that we are so nobody wants to become mad.
Okay.
So things that are psychological, people like to hide.
Sure.
So you see that people come to the clinic, the person is not looking happy. It's for you, the doctor, to look at these things and ask questions. Are you okay? You don't sound sharp. A woman who does makeup, nice, beautiful woman, comes to the clinic with makeup. All of a sudden, one day she comes, boom, no makeup, no lipstick. You have to ask questions. Also, you need to ask, where's your husband? Since the beginning of this antenatal, I've not seen your husband. Are you okay? Where's your husband? Or you're not supposed to pry too much on his privacy.
Private life.
But this should serve as trigger point for you to know that no, this thing could be a problem. Also, if you're a doctor, you realize this woman has struggled through pregnancy like that. There's one couple, like one pregnant woman, pain during pregnancy was so recurrent. So you can imagine that this woman, just after delivery, the baby had to be admitted to NICU.
That's a lot of stress.
All right, this woman has gone through a lot of stress. And you see, the woman will start asking you questions. Hey, doctor, am I going to be okay? I'm scared, though. Where's one of my clients? Doctor, I'm scared, though. Hey, are you sure I'm going to be okay? And I was going to do cesarean section for her anyway. I'm scared, though. Do you think I'm going to be okay? You realize this woman is having some issues. So, when the baby was delivered, the baby had to be admitted to NICU. I had to be more active, to the point that I even had to carry this woman who was just one day post CS.
Okay.
I had to carry her to the NICU to go and see her baby. Even that, she was still not convinced the baby was fine. Until by evening, when we brought the baby to the woman started cheering up. Looking at all these things could tell you that this woman is likely to develop postpartum. Okay.
So to our pregnant women out there, it's okay to seek for help. Speak to your doctor, speak to family for support. Don't keep everything to yourself, because postpartum depression is very common. We'll go for a short break, and when we come back, the show still continues.
the first 2 years, your baby will experience amazing growth in so many ways. To fuel it, they need the right nutrition. With Cerelac, 1 bowl of goodness a day provides the wholesomeness of carefully selected grains, the Iron Plus, which helps support brain development, and the yummy taste baby loves, assuring you the right nutrition in 1 bowl. Cerelac, it's all good, Mom.
This advert is FDA approved.
Welcome back. If you just joined, it's still the Pregnancy Care Show, and it's time for us to hit the street to take questions and comments from our viewers.
Me did the anti-rose. Me found my dear Dansoma market. Doctor, me person me who say, can PPD lead to madness?
But you are a friend or damn me electrician or Dansoma market. If you say me bisa doctor say Emma echo a was bar. I was say or ye depressed na.
My name is Samantha. Doctor, do partners in any way contribute to PPD? And if so, how?
So those were some questions from our viewers, and Doctor is going to answer each and every one of them. So Doctor, our first viewer is asking, can postpartum depression lead to madness? That is what she said. So maybe a deeper clarification on that.
So madness, nobody's mad.
Okay.
I won't say anybody's mad. It's a psychological or psychiatric problem. That we need to help the person with. So, but madness may be the person's words.
Okay.
It's when the person has become like psychotic, the person is moving around, where you, like removing the shirts and moving around. That's like the extreme form of madness or psychological or psychiatric issues. But any woman who has postpartum depression has a tendency of becoming psychotic later in life or developing major depressive disorder later in life. So it's something that this person needs to be monitored. Actually, the person needs to seek medical or psychiatric evaluation, or this person can later develop. Okay.
So our next viewer is asking, naturally, should a mother be depressed after childbirth?
Naturally, what is natural about this? The thing is that quite a number of people, the birth period is stressful. You know, we all have different ways of reacting to stress.
Okay.
So the person might not be depressed per se. As I said, the person might have some blues, like anxiety. The person is feeling some anxious about the whole change in her life. The person might just be feeling a little bit down after the stressful labor period and pregnancy period.
Okay.
These are quite common among women. As I said, almost 70-80% of women after delivery will have these issues, but not to become depressed.
Okay.
We have to prevent the person from getting to depression.
Okay, so our last viewer is asking, do partners in any way contribute to women having postpartum depression? So I think she's asking of maybe worrying partners, especially the male partners. With this question or with this answer, I want you to look into the camera and speak to the men in case they have any contributing factor to that.
So to our partners, a good support system is always good for any home, not just even after childbirth. But in addition to childbirth, there's this stress of having to breastfeed this baby. It's quite a very stressful moment for a woman's life. A good support system, especially from a partner who keeps reassuring her that it's well, it's going to be well, goes a long way to support this woman. A partner who gives stress, additional stress to a woman who's already stressed, more likely will tip this woman to severe forms of blues and depression and even psychosis. The partner should also, you know your person very well. So you are a person who can actually identify when the woman is really start having these mood changes and mood swings. So you are very important. And we treat every man that you should be there for your woman, especially during these challenging moments of her life. Thank you.
So doctor is entreating all male partners to be there for their wives during the period of pregnancy to delivery and even after delivery. Please, no stress at all. And I hope our questions were clearly answered. So doctor, with this postpartum depression, what is the effect on the involved babies?
So the thing is that this is a woman who does not even want to. Some of them actually see the baby as a problem.
Oh, okay. A baby she had birth.
Yes.
She sees the baby as a problem.
No, the baby is the one who has given all these problems.
Okay.
All the stress she has to go through labor. Some of them also feel like the baby, there could be something wrong with the baby. Especially the woman who had her baby admitted at NICU.
Okay.
So this woman really feels like there's a problem with this baby. So what happens is that they don't even have a drive for anything. They don't have a drive. They don't have interest in their surrounding. So they don't even want to breastfeed. So and then, the baby needs breast milk.
Yes.
Especially the breast milk that comes just after delivery. It's called colostrum, and it's very good for the baby. So this is the period where people have to come in and then support this child with maybe some temporarily support this baby with some maybe additional feed like formulas and stuff.
Okay.
So this baby actually might be neglected by the mother.
Wow.
But the dangerous part of it today is that this woman can harm the baby. There's been stories where a mother who has just delivered has killed her own child. Because sometimes they might think that the baby has a problem. Let me just end it all. So the two things that can affect this woman, the baby, is that breastfeeding can be a problem. And then also the baby can easily be harmed.
Okay.
And this baby, sometimes the bonding between this baby and the mother could be challenged. That short period after delivery is really important, because this woman needs to bond well. And you see, this woman is going to be with this baby for like breastfeeding period of about 6 months, 1 year, 1.5 years. If that initial stages, the bonding is not created, sometimes it really affects the whole mother-baby bonding. And it's not nice for the baby.
So Doc, what are the treatments or the management options for postpartum depression?
So when you realize that the woman has postpartum depression, don't end there.
Okay.
Depression is deeper than the blues. The blues is like feeling of small, and then it's short period. The person is fine.
Okay.
Depression needs treatment, management. So this person, the first management the person needs is the family support.
Okay.
The family must know that these things happen. They happen, and that they should be there to support them. They should never neglect this woman to be on her own, because it could be a dangerous period for this woman. The second thing, that this woman needs to be evaluated by a psychologist, and most importantly by a psychiatrist.
Okay.
The person must be evaluated so that we can and the person actually might need medication at a point.
Okay.
To help the person out of this depression. And most importantly, the person needs continuous monitoring. Because the person can have flare-ups. It can just all of a sudden flare up again. And we need to do this to help this woman.
Okay, so what are the complications from postpartum depression?
So we've spoken about the mother, the baby. The baby can have issues. The thing that we saw that could happen to the baby. For the woman, it could be dangerous for the woman. If the woman doesn't want to eat, between the woman herself and the baby, the bonding also will be a challenge. Another challenge is that this woman can kill herself. And that we shouldn't neglect. The woman can kill herself. When you suspect it, watch her closely. Could be a difficult complication. And the woman is depressed. The woman is not actually, she's not committed to taking care of herself. What means that she can develop problems with her breasts.
Because she's not breastfeeding.
Yes. So she can have engorged breasts.
Right, okay.
Even the position of the baby, she's not committed to it. She doesn't have interest in the surroundings. Position of the baby can be a problem. So she can start developing cracks in her breast.
Okay.
And she can have breast abscess. She can easily get what we call preparal sepsis, where she gets infection from because she's not taking care of herself.
That's quite a lot.
She's not motivated to do it, and this could be challenging.
Okay. Let's go for a short commercial break. When we come back, we'll look at some tips on today's episode.
In the first 2 years, your baby will experience amazing growth in so many ways. To fuel it, they need the right nutrition. With Cerelac, 1 bowl of goodness a day provides the wholesomeness of carefully selected grains, the Iron Plus, which helps support brain development, and the yummy taste baby loves, assuring you the right nutrition in 1 bowl. Cerelac, it's all good, Mom.
This advert is FDA approved.
Welcome back. If you just joined us, it's still the Pregnancy Care Show, and we are looking at postpartum depression. The show is brought to you by Cerelac. Let's look at some tips on today's episode. Prepare yourself and your partner well before childbirth. Talk to your doctor about how you feel during pregnancy, labor, and delivery. Ask your partner to assist or take an overnight feeding to help you get a longer stretch of rest and restorative sleep. Pay attention to your nutrition and eat healthy diets. Get daily help from close relatives and friends during postpartum phase. Take yourself out, have fun, watch a movie, read a book, listen to music, and take a bit of dark chocolate. Those are some tips on today's episode. So Dr. Isaac, what will be your final words on our topic for today? And if you have anything, can you look straight into our camera and then give it to our viewers?
Right. Pregnancy comes with a lot of issues. For me, I always say that as soon as you get pregnant, the baby has to come out. The baby will always come out. And the thing is that a woman who has been living a single, free life, moving around happy, now you have another baby you have to take care of. That period could really be challenging. I want to encourage that every woman know yourself and know when to ask for help. Don't keep these things to yourself when it's happening to you, because it can get to the point where you lose the control. Family and friends, please, let's support these ones when they have this challenge. And nobody's mad. We all have different degrees of psychological problems. Thank you.
Okay, so doctor, thank you so much for coming on the Pregnancy Care Show today. We are looking forward to having you next week on our show. I hope you make time.
Sure, I'll be here.
Okay. So on today's episode, we were talking about postpartum depression and everything we have to know on postpartum depression. But the most important thing we have to do is support. Family support. Be there for your wife. Family, be there for this woman. Maybe your support could help her get much better, even that she might not even have to enter into postpartum depression. Thank you for watching this week's episode. The show was brought to you by Cerelac, and my name is Dede. If you have any comments, any questions, leave them on all our social media handles at The Pregnancy Care Show, and keep subscribing to our YouTube channel at The Pregnancy Care Show. You can also follow me on my personal IG page at Dede_Ga. We'll leave in all your questions, anything you want to know about the show. See you next week.